When you're first told someone you love is dying, when they're first told, it's a terrible time, it really is. There are so many things to think about and worry about, and you need to talk about them, there's no other way. When Val was told she was dying, one of the things I knew that were worrying her, she wanted to die ideally at home or in the hospice. And I know this preyed on her mind. And our GP, Dr. Chumley, came and she introduced us to the My Care Choices register. And this was great because it meant that Val's wishes had been listened to. She knew they were written down and that somebody would pay attention to them. And if at all possible, she could die at home. As soon as we did it, we had a visit from the occupational health people who came and checked that the house was suitable. Obviously, if you want to die at home, there has to be space for a hospital bed and other facilities, which we had. From experience, I know it works and it works well. Towards the end, Val was deteriorating. The medicines to relieve her symptoms weren't working. She couldn't get into the hospice, there wasn't a bed available, so they took her into the general. The specialist came round and told us what we already knew, that the medication wasn't working. And he said, we have one more shot in the locker. If that doesn't work, there's nothing more we can do, we just have to let nature take its course. And then he said, I see from your notes you want to die at home. If the treatment doesn't work, then we will arrange that. And the effect of that was amazing. It was like pulling the plug out of a bath. The stress and worry just seemed to drain out of her. It was quite remarkable. As it happened, the treatment worked and we had several more wonderful months together. And in the end, thanks to the My Care Choices register and Single Point and a raft of other services Essex Cares, Val died in the house she loved. The support we had was phenomenal. People and equipment just seemed to appear out the woodwork unasked and made my life so much easier. In the end, Val died how she wanted, in the house we'd lived in for 30 years, surrounded by all the memorabilia of a very busy, happy life. She died in my arms. I had time to kiss her one last time, tell her I loved her one last time. She gave a huge sigh and went. In part, we were able to do that to a very important part because of the My Care Choices register. If you're faced in the situation we were in, two things: talk about it, talk to each other, and talk to the hospice, to your GP about the My Care Choices register. It works, it can work for you.